More and more people at a younger age are being diagnosed with diabetes as time passes by. According to the article of Endocrinology Advisor by Sheezer, the youngest person to be diagnosed with diabetes would be a 3-year-old girl. Even though both of her parents are overweight, they had no family history of diabetes. The child's diet went under review, and it has been revealed that it had poor family nutritional values and contained lots of calories and fat. Diabetes is an impairment of how the body regulates and uses sugar, or in this case glucose, as a fuel. This long-term chronic disease is a result of too much sugar that runs through the bloodstream. Eventually, high blood sugar levels can lead to disorders in the immune, circulatory, and nervous systems. According to the article of Center of Disease Control Prevention, 34 million Americans have diabetes, which would be 1 out of 10 people. Around 90 to 95% of them have type 2 diabetes. Usually, diabetes can develop around the age of 45, but more and more children, teens, and young adults are developing it as well. So we just talked about what diabetes is, and now we will discuss how common it can be, how to manage and how to treat it, and finally how to prevent diabetes. Since diabetes is becoming more and more common in the United States, here are some more basic facts about it. Like as I mentioned before, the vast majority of people who have diabetes have type 2 diabetes. According to the article from Life Science, 1 out of 10 people have diabetes, but if new cases continue to develop, the prevalence of it could double or even triple in the next 40 years. In America, the cases of diabetes have doubled in the past 20 years. It is currently the leading cause of death in the world. In the United States, it is ranked as number 7 and has a higher mortality rate than the rest of the world. If cases continue to develop at this rate, by 2050, 1 out of 3 people will have diabetes. Type 2 diabetes is the most common form of diabetes. It is triggered by some unchangeable factors such as race and family history, but also with changeable factors such as obesity and inactivity, or more known as lack of exercise, according to the article by Mayo Clinic. It can be the leading cause of leg amputations, kidney disease, and new cases of blindness for people under the age of 75. According to an article by WebMD by Danziger, with the aging population and the growth of minority population, it is expected to add to the prevalence. African Americans, Latinos, Native Americans, Asians, and some Pacific Islanders are at a higher risk at developing diabetes. So now we know how common it can be. Here's what we need to know on how doctors can diagnose and treat diabetes. Modern medicine have many ways of dealing with it, and because of that, doctors do it as well. Because it can last for a very long time, here are some ways how it can be managed. Exercise and weight loss can go a very long way. It can minimize symptoms and complications that result from the diabetes. If it is discovered early, you have a higher chance of being able to control diabetes and the blood sugar levels. Metformin is a tried and tested medicine for many decades. According to an article by Harvard Health Publishing by Estafida, metformin is recommended by most experts as a first line of therapy. It is known to be safe, affordable, effective, and well tolerated by most people. When metformin doesn't adequately control blood sugar, other medication has to be added as well. At this point, both patient and the doctor can discuss on the many drugs and drug classes that are available to treat diabetes. In general, for people who have low risk of heart disease or no history of diabetes kidney disease, most medications that are added to metformin can reduce blood sugar in an effective rate. Lately, there's a newer treatment option for diabetes, which is a glucagon-like peptide receptor agonist and sodium glucose cotransporter inhibitors that are being heavily advertised. These newer drugs can lower blood sugars and have cardiovascular and kidney benefits. So while medical professionals do have ways to treat it, there's a bit of care for your own self can go a very long way. Fortunately, there's still many ways in how diabetes can be prevented. So let's look at some of the best ways and how we can do so. Once again, as I mentioned before, the best methods to prevent diabetes would be to do exercise and to eat right. One of the basic methods that can be most effective is to have a healthy meal plan. It's important to reduce the amount of calories you eat and drink in the day, and that you lose the weight and keep it off. This would include eating smaller portions and consuming less fat and sugar. You should also be eating a variety of foods from each food group, such as whole grain, fruits, and vegetables. And it would be a good idea to limit red and processed meat if it's possible. Another great way to prevent diabetes is to do exercise on a regular basis. According to the article by Medline Plus, losing weight and keeping it off, or known as weight control, is important for prevention. They recommend that you lose 5 to 10% of your current body weight. So for example, if you weigh around 200 pounds, the ideal goal would be to lose 10 to 20 pounds. Getting exercise on a regular basis have many health benefits, which includes losing weight and to lower your blood sugar levels. So the best way to do it is to try to do 30 minutes 5 times a week. And if you have not started yet, it is best to talk to your doctor so you can discuss about what are the best types of exercise that you can do. That way you can start slowly and start working towards your goal. In conclusion, we have talked about what diabetes is, and then we talk about how common it can be. Secondly, we talk about how it can be managed and treated, and lastly, we talk about how it can be prevented. Hopefully that way, one can start or continue living the healthy life that they are doing, and like that, we can last for a very long time. While type 2 diabetes is a real risk, especially for anybody with an impaired immune system, it is important that the benefits of modern medicine that we have nowadays can still outweigh the risk. Therefore, it is always best to be on the lookout for potential health problems. But most importantly, the way how you take care of yourself can go a very long way and can be much more beneficial.